Welcome to the medical moment from Marina Hills Animal Hospital. We're recording today at Top of the World Park in Laguna Beach. It's a beautiful, almost spring day. It's been raining a lot this year, which means there's lots of grass and green on the hillside, which means in just a few short weeks there will be lots of rattlesnakes. So this week's episode is brought to you by the letter R. That's rain and rattlesnakes. The best way to protect your pets from rattlesnakes when you're out on walks with your dog, keep them on a leash. Because generally speaking, snakes want to be left alone, and they'll tell you, leave me alone with that rattle. And if your pet's on a leash, you can about face and head the other way. Unfortunately, many dogs don't know what the snake is saying, and they move in closer for a closer look. And frequently we see dogs there at our practice in Marina Hills that have been bitten on the face as they're checking out a snake up close. So again, best defense is to keep them on a leash. The challenge is if your home is rattlesnake habitat, which right around the office, that is the case, there's a chance that snakes could join you in your yard. There's some things you can do to make your backyard less of a snake habitat. It turns out that snakes do not like to hang out on lawns, but they like brush. So if you can keep the brush off of your hillside, off of your property, that's a good first step. Snakes like wood piles, they like piles of brush, old leaves. They also like rodents, they like to eat. If you are feeding birds in your backyard, there's a good chance the birds are sharing their bird seeds with rodents, and that means you're feeding snakes. And so you might reconsider, depending on where you live, if having that bird feeder outside is a good idea if you have dogs in the backyard. Finally, it turns out that when dogs are bitten by rattlesnakes, one of the first things that happens after, well, interestingly, not every pet that is bitten by a snake receives venom. So it is possible for a dog to be bitten by a snake and not much happens. Or when a snake bites, it may give a small amount of venom, or the snake may inject a large amount of venom. Interestingly, small baby snakes tend to release more venom than big adult snakes. I don't know why, but it's true. The result when dogs are envenomated is the first thing that happens is local pain at the bite site. So if your pet is very painful and has a small amount of blood dripping from their lip, there's a chance that they were investigating a rattlesnake who said, leave me alone. Very shortly, there'll be local swelling at the injection site, and some dogs, not all, will have a shock response to the bite. Shock is when the body hits the panic button, they turn pale, they collapse, they may have vomiting or diarrhea. It's never a good day if your pet is envenomated by a snake bite, but it's the worst day if they go into shock, because that part can be life-threatening very quickly after the bite. It turns out that there is a product, it's a rattlesnake vaccine, so to speak. It's an anti-venom that, when injected into your pet as a vaccine, will introduce them to subcomponents of venom, so that if they're ever bitten in the future, they have less of a chance of having that anaphylactic shock response to the snake bite. That does not mean that vaccinated pets can safely walk through snake pits unharmed. It does reduce the chance of that anaphylactic shock death experience should a vaccinated dog be bitten by a snake. Interestingly, cats are usually too smart to be bitten by snakes. I won't say it never happens, but dogs are much more likely to be bitten by a rattlesnake than a cat. There's some good news for cat owners. If your pet is bitten by a snake, the best thing to do is to transport them directly to an animal hospital. If that's during the hours of 8 a.m. and 6 p.m. Monday through Friday, that's Marina Hills. If it's after hours or on weekends, the Animal Urgent Care in Mission Viejo does an excellent job of caring for emergency patients. The first thing when you arrive at a pet care facility that will happen is your pet will be evaluated for shock. And if they're in shock, they should be treated for shock with IV fluids. That's the most important part of the treatment. If you have an opportunity to give your pet Benadryl, antihistamine, before you transport them to the doctor, talk to your veterinarian and find out if that is appropriate for your pet and what dosage would be appropriate for your pet. But giving an antihistamine as you're transporting, if you can do it easily, and don't make an extra stop at the drugstore to buy this, okay? This is if you have it with you. It could help sedate your pet and slow them down so they're not as anxious, which can help following envenomation, and it may also help blunt their reaction to the venom. Not nearly as much as the true anti-venom serum. There is a treatment available many times at animal hospitals which directly binds to the venom in your pet, so it is not circulated throughout the body. It's expensive, but if it's administered shortly after the bite, it is very helpful. So that's the story on snake bite. After the first initial results of being envenomated, some pets will also have bruising. They'll have trouble with clotting their blood. They may have death of tissue at the injection site. They may have secondary infection. So clearly it's something we'd like to avoid rather than experience. Takeaway message: keep your pet on a leash and enjoy the view. It's a beautiful day here in the Saddleback Valley. Check it out. If you made it this far in the video and you're in the Saddleback Valley and you're interested in having your dog vaccinated against rattlesnake venom, call the office, Marina Hills Animal Hospital. Tell them you saw this video and that you want a $10 discount because Dr. Simon said so. We're all about helping pets stay healthy and safe. And if you like the video, if you like the discount, like it, as in click the like button, share it with your friends, and let's see if we can't get all the dogs at risk vaccinated against rattlesnake venom in Saddleback Valley. The phone number at the office, 949-495-2224.